the main difference between the system that we have here at Peak LILT, the Bioflex, is that it utilizes a 3-step process. So we start with the array, which has 240 SLEDs, superluminous diodes, that first initially deliver red light from the red light spectrum, which is visible to the human eye. Okay, and we place that on the injured area, and then it runs for a certain specific amount of time based on the protocol of what is needed for the injury that we are treating. And red light penetrates tissue up to about 1 centimeter in depth. So it starts a tissue healing process up to that level. And then the other thing that it's doing is it's saturating the cells so that they can then accept more light photons. So then after the red light has run its course for approximately 6 to 8 minutes, then it automatically switches over to infrared light frequency, which is not visible to the human eye. But so then it runs infrared light for a set amount of time, and infrared light on its own can penetrate up to about 2 to 3 centimeters in depth on its own. But because we have already run the red light through the tissues, now it can penetrate up a few centimeters deeper. Then these 2 steps are then followed by the use of a class 3B cold laser. Cold laser is just infrared light. It's just a highly concentrated beam of light so that it can penetrate fairly deep into tissue. On its own, laser can penetrate about 4 to 5 centimeters in depth, but because we have utilized the red and the infrared light with the array first, now it can actually penetrate up to 8 to 10 centimeters in depth, thereby allowing us to be able to reach things such as intervertebral discs in the lumbar spine, or inside a hip capsule to get to the labrum or the hip joint, or inside of a knee joint, etc.